Okay, so we are back now with Romana Data of Bergamo, Italy, and I'd interviewed you about a week ago, maybe 8 days ago,
Yeah,
just when the outbreak had started.
approximately.
And how I know Ramona is through an amazing dancer. Her name is Angela Gladu, and so you had met her at one time, and you'd all connected.
More than one. Yeah.
So if there's anything for people who don't know who you are, could you please tell us? Share that with us.
Okay. Brief presentation of myself. I am 72 years old. I grew up in Sweden. I have been a translator all my life. Now I'm retired. I run with my son and my husband a little bed and breakfast, and we are very close to the city of Bergamo, which is the worst hit by coronavirus in Italy. We have had a very, very bad period during the last month or so. I live in an apartment with my son and with my husband. My husband is 76 and my son is 52. I also have a daughter who lives in England with her own little daughter, my grandchild. I guess that this is it about myself.
Okay. You already explained where you're from. How big is the city of Bergamo?
Bergamo itself, as city, has about 160,000 inhabitants. It's in the center of a very industrialized area, full of small and medium-sized industries that practically support most of Italy's industrialization. I mean, they are the ones who make money, if we want to say so.
Wow. And what is the current infection rate? Is, geez, I just had the numbers here a second ago.
Sorry.
What do you know the current? Oh, so there's 15,887 deaths, and there are nearly 129,000 confirmed.
Yeah, okay. Now, 15,000 and so deaths are all Italy, right? Mm-hmm. And of these, the official figures. Of these, the official figures of Bergamo, which is absolutely not the biggest of the cities, are 951. But these 951 are, as we said, official. So the authorities of both Bergamo and all the surrounding smaller cities, which are many indeed here, you can't see where one small city becomes another. They are all one after the other, right? So all the authorities say that the official figure is at least 5 times as much. So here in this area, we have had about 5,000 deaths that were the other years they were just 1/10 of that.
Yeah. Mm-hmm. When you say official deaths, do you think that there are more people who have passed away from corona that is being reported?
Yes, I do. Absolutely.
Why do you believe that? What makes you think that that's a reality?
For instance, not everybody has been tested on coronavirus. Mm-hmm. Only those who have been taken into the hospital and died after having been tested are coronavirus victims. The others are all victims that were not coronavirus tested. But there were not so many deaths 1 year ago. And this is not what I am saying. The mayors of the various surrounding cities are saying that, all of them, even the mayor of Bergamo says that.
So there's people who are dying there are people who have died at home, is what you're saying, and they're not counted as people who tested positive for COVID.
people who died at home, and until not so long time ago, people who died in retirement homes. All of a sudden, there were a lot of elder people dying.
And those people weren't tested.
But they were never corona tested. No.
Wow.
No, they just died there.
What did they do with all of those? Who came to retrieve the bodies? Because I had heard that there were some people who had the bodies were at their house for like a couple of days. Is that true?
As a matter of fact, no, not here. They take away when somebody dies. He is brought away immediately. Mm-hmm. If he is or not coronavirus infected officially, he's taken away immediately, put in a coffin, and nobody sees him anymore.
Yeah.
So they are all brought to some either to the churchyards or to the churches even to other places that have offered space for coffins, because there have been so many coffins that they didn't know where to put them anymore.
So many people have died that they don't know where to put the bodies. You said last time we had talked, you had said that they were cremating people. Just as soon as you had your body, they cremated you.
Exactly. But the crematorium here in these areas, they didn't have time to cremate everybody. Therefore, the army comes in. In fact, still comes in every at least once a week in the last month with I don't know how many trucks, and they were brought away to other cities in Bergamo, in Italy, to be cremated elsewhere, like it happened to my neighbor. They found him dead in his bed. He was living alone. They came, they took him, they put him in a coffin, and you don't have a chance to make any funeral or anything. You just take them away, cremate them, and then you get back the container with the ashes.
So I'm just trying to grasp what you're saying. Once a week, the army comes in to retrieve bodies, and then
last month, yes.
And then a little while later, they come back with ashes.
Yes.
So if they're doing a mass burn, are the ashes? Is it just like? Do you know if it's the actual ashes, or do they just compile them together and then they give you some from that day?
Well, I know. All I know is that they cremate coffin by coffin, and each coffin has a name, of course. And the crematoriums should be the same everywhere. So hopefully you get back the right ashes.
Yeah, that's because I know that in China, I think it was in China when they were doing the mass cremations, you would just get like an urn, and all it had was the date of the cremation. It wasn't necessarily your loved one. It could have been, but it was like your loved one was burned on that date. How have the conditions been now within this last couple of days? Because what I'm reading about Italy is that there's been a drop in deaths per day and also new infections. Is that true?
Yes. There has been a good drop, but they're still dying. Of course, there's still people who just don't make it. So those who already are in hospital, they are getting better, some of them, and some of them, unfortunately, not. Just pass away. There is a drop, as I said, in the deaths, and there is also a drop in the number of people being taken to the hospital every day. But still, we have more people coming in every day. I mean, today we had over 100, let me see. Today, 103 people more came into the hospital. And also, the numbers of the infected people is growing because now they are testing everybody on coronavirus. Everybody, not only who is taken to the hospital, but everyone in the family or who has had anything to deal with that person are being tested. And therefore, they are discovering people who don't know that they are infected because they don't have any symptoms. Yeah. And that is the big problem. That is the big problem. Mm-hmm. That they don't know.
If we go back to the earlier days of this, before it started, because Canada right now, I think we've nationally, because Canada's a big country. I think we've hit about, I think it's 10,000. Within our province alone, we just passed 1,000. And in the city that I'm in, it's just, I think, about 650 or so. The number's going to go up today. How fast did it spread? Like, because there's a lot of people saying right now in Canada that it's not that big of a problem. It's not that big of an issue. Stop letting fear guide your decisions. You know, you could still go to the park. You could still go visit friends. Like that's the current, there's a healthy population that actually believes that. How fast did it spread from those beginning days to like total shutdown of Italy to these deaths? How many days?
It was a shock, really. Now, I give you my example. End of February. No. On the 14th of February, I went to England to visit my daughter and granddaughter, and everybody was already talking about the first few cases in Italy, but there were no prohibitions. So I left with my face masks and with my cleansing gel to make sure, disinfecting gel for my hands, to make sure that I touched as little as possible on the plane, and that I had my mask on in case, but nobody was wearing a mask, okay? I came back on the 24th of February, 10 days after, and during the last 2-3 days before I left to come back home, they were already talking about more and more deaths and how about the situation was degenerating. I came back on the 24th, and nobody was compelled to wear a mask. Everything was still open, but there were more and more deaths. Beginning of March, it was the chaos. Beginning of March, our government told us you are not allowed to go out anymore unless you go shopping for food, and you have to go shopping for food within your own town, in a nearest shop. They didn't say then that everybody had to wear a mask outside, but now, from last Sunday, we must wear a mask wherever we go, as soon as we go out of the door of our apartment, and we are not allowed to go where we want. It was such a fast thing. In 2-3 weeks, thousands of people died.
Because we're like, I feel that Canada is right at that cusp right now I think like Ontario, they're projecting that it's going to be 18 months if they don't. They're trying to lock it down in Ontario. Some provinces are a little better than others, but I feel like Canada is still at that cusp of falling into Italy. I know, and like the United States is already well on their way, but I feel like Canada is just at that point of going into this sickness. And so you're saying it was just people sick, and then some people more sick, people dying, and then all of a sudden it became like a lot of people dying?
Yes. At the very beginning, I'm talking about end of February, when everything had already begun going on for some time in China, and they were almost finished there. We were told, okay, this is a kind of flu. It's just a little worse than the usual flus, but there are thousands of people dying every year because of flu, and you surely won't have so many cases, so don't worry more than that. It won't be that bad.
Yeah.
This is what they said to us. So at the beginning, when we started, because myself, I had problems, I had health problems when I came back from England. So when you start coughing and you start having a fever, not a very high fever, a low fever, and you have some other little problem, you think, oh my God, here's the flu again. I did have a vaccine last year, but all right, it happens. I have a flu. I have a flu. It didn't happen to me, but to others like me. It started like that, and then all of a sudden they couldn't breathe anymore. And they had lung inflammation on both sides. They couldn't breathe, so they were taken to the hospital. And that was coronavirus. At the beginning, even the emergency rooms at hospitals said, okay, we have many more pneumonias than we used to have in the other years. But they immediately saw that they couldn't heal them. The usual things they were using were not enough, and they had to be you say intubated. Yeah, and they were dying. So it is not a simple flu. It is not a simple flu.
Because we have they have this thing called reservations where we live in Canada, and essentially that's where they put all the native people. They cleared the plains and the cities, and they put all the native people, and that's essentially kind of our homes right now. Not for all of us, but for some of us, most of us, we have a reservation we can go back to. Some of these reservations have very strict. They have 0 confirmed cases. A lot of them. There are outbreaks that are happening on some reserves, but for those places that are having like 0 cases, the nation, the chiefs, are putting heavy restrictions on the people. Preventative measures.
They are right.
Pardon?
They are right. They do it right.
That's the right thing to do. Because some of the things that they're doing are saying not to leave the res unless you absolutely have to get necessities. There's curfews. Yes. There's social distancing. Yeah. They're telling people not to go visit your friends or family. Do you think that this is an overreaction?
No. Absolutely not. The sooner you make it, the better it is.
Is it because it spreads so fast?
Yes, and because the incubation is in my opinion, is the real enemy. It means that you don't know that you have the virus. You are okay. You are feeling fine. But you do have it. You do have it for 14 to 20 days. You are incubated, and you go and you spread it to everybody else without knowing it. So if you are incubated in the place where you live and you go to the reservation, and you start, even if there is a distance, you don't wear a mask, you touch the handle of something, and somebody else touches the same handle after you, that is enough, they are saying. This is what the doctors are saying.
To get them sick.
Yeah. It spreads so quickly and so it stays alive for a couple of hours on different surfaces. So if I open my door now and somebody else opens the same door after 10 minutes and I was incubated and I left my virus on the door handle and you come afterwards, you might get it.
How scary was it living through the deaths? Because there were so many, and that's all we saw.
Terribly scary.
What could you talk about?
You hear. Believe me, you go to bed, at least me, I am a positive person, but each night I went to bed asking myself, how will it be tomorrow? Will I wake up? Will my husband wake up? Will my son wake up? Okay. Will there be a problem if one of us is taken to the hospital because we are not okay? Will I ever see him again? Once you are in the hospital, you are isolated from everybody. And if they intubate you, you don't even have a chance to talk directly through Skype like we're doing now, because they intubate you and they make you fall asleep. Mm-hmm. And you are unable to contact anybody, and you die without seeing or being contacted by anyone or the dear ones, your family. It was you die alone. I have seen, I have talked to doctors and to nurses who say we are doing our best to hold their hands and to stay with them when we see that they are about to die. But of course, it's not the same thing. Some of them don't know that they are dying, but some of them do know.
You said you currently run a bed and breakfast, right?
Yeah.
So there's been in North America the Airbnb, the electronic Airbnb.
I know.
They're hitting a crash point right now because nobody is staying at their Airbnbs. But I understand you had a bit of a solution, and it was a bit of humanitarian aid. Can you tell us what you did with your Airbnb, B&B, or sorry, with your bed and breakfast?
My bed and breakfast is closed, like all bed and breakfasts and hotels in Italy, not just here. Everything is closed. So my bed and breakfast has been closed for over a month now, and it stays there empty. I have 4 bedrooms and 2 bathrooms. So I decided, instead of keeping it empty, I'll give 2 rooms free of charge to any doctor or nurse or anyone else who works in the health industry, to if they come from far away or if they need a place where they can stay. And therefore I have 2 doctors upstairs who stay free of charge.
Do you worry that they might bring back the COVID virus to the house?
The first thing they said to me when they arrived was, stay away from us. They work in the ICU, I think you call it.
Yeah.
Right?
Intensive care unit, yes.
Yes, exactly. They work in the intensive care. And they said to me, both of them, we are never touching each other, never going close to each other, trying not to be in the same place when they are there. They have their room and they clean their own room and they clean their own bathroom. All we do is go up every day, open all the other windows and spray disinfectants on every surface they might touch, like the dishwasher or the sink in the kitchen, the refrigerator door, the chairs, anything that they might touch. They have the possibility to cook for themselves, but they don't have time to do it. They make very long shifts. And therefore they asked me if I could provide 1 hot meal a day for them. So each night when we cook dinner for ourselves, we also take up 2 dishes for them, put them on the table, and whenever they come home, they just need to heat it up in the microwave. And I told them that they can stay as long as they want, even if it's difficult for me, because the B&B is our income source.
Mm-hmm.
We get a small pension from the government, but we could never survive on it. And actually now the banks are giving good loans and supporting us, I hope. So they said, but so far they haven't yet.
Yeah.
I need the income coming from my B&B, but I told them, stay just as long as you want, as long as you are needed, and as long as this goes on, you can stay here free of charge. But nevertheless, they decided to give me a small amount to cope for the food that I'm giving to them.
So we're having some food security issues here in Canada. Not because the farmers or because anybody has really stopped working, but it's because richer people are going out and they're buying out the whole store. It's creating food shortages. Are you worried?
It happened here.
It happened there? How long?
It happened at the beginning.
How long did it last for? How many weeks?
1, 2 weeks, maybe.
Because I think we're going about week 3 now, 3.5 of people like spending thousands upon thousands of dollars on food they're just not going to eat. Are you worried?
That's very stupid.
It is. It's crazy. Are you worried that because this is a lot of our fears we have in Canada. Some of our fears is that we're worried that crime is going to increase the longer that this goes on.
Well, not here. Nobody's out. Nobody out there. You didn't see anyone.
So, is that because they're not allowed out?
Nobody's allowed out. And the police stops you. Today I was stopped by the police. Today I went shopping for food. And we are forced to carry with us a piece of paper which is a self-declaration. In this declaration, we have to write all our personal data.
Yeah.
And we have to say where we come from, so where we started our journey, where we have been, and why.
Yeah.
The reasons why we are allowed to go out is shopping for food, or going to the pharmacy, or going to the doctor.
Yeah.
But if I want to go to my house doctor, I'm not allowed to just go there. I call him in advance and I tell him, I need to see you. What for? For this and that and that. Okay, come at 9:30. And then he has a studio, but you are not allowed to go into the waiting room. You have to wait outside, 2 meters distance from everybody else. And the secretary comes out and takes you in when it's your turn.
Mm-hmm.
Right? So this is how it works. If you have a dog and you want to walk your dog, you're allowed to do that, but only 200 meters from your home, and for maximum half an hour. You're allowed to make physical exercise in your own garden and nowhere else, or at home. No parks are open. They are all prohibited. All parks, parklands, playgrounds, everything is closed. All the shops are closed. All the restaurants, all the bars, all the factories. Only factories who make something essential for medical care or for food production or so are allowed to be open. Everything else is closed. And nobody is allowed to be outside.
Do you think that, do you see these restrictions as an overreaction?
No.
Do you wish that they would have started?
And believe.
You believe?
Yes. I wish they would have started earlier. And although it is very difficult, it is very hard to stay at home like this, locked in your own home. I am ready to do it for at least another month if necessary.
Do you what are your, like, day to day, what are your biggest challenges? Your personal challenges?
Keeping a good mood.
Imagine
that's the most important thing.
Imagine it gets a little trying, because how many days have you been in lockdown?
1 month.
1 month, 30 days.
Yes. It's the fourth week.
Wow. And you're ready to go for another month?
Yes.
So how are you holding up with all of this? How are you feeling like right now?
I am hopeful because I can see that things have become a little better.
Mm-hmm.
But we know that we must keep on doing it because they are talking about a return. Because of people who don't know that they are ill, and if everybody starts going out again, we might get infected.
Another second bout of infection, the second wave of infections.
Yes, the second wave, yes.
So, but like as of like today, how are you feeling? And this is something I want to kind of focus on, because I don't think we say it enough to each other in Canada, anyways. Just checking in with people, like, how are you actually feeling right now?
I wish it would end tonight. I wish I could wake up tomorrow morning and go and see my granddaughter and daughter to see that everything is okay. Go down to the village where my husband was born to see if his brothers and sisters and everybody else is fine. Hug each other. Not just talk to each other from the balcony. Make a shopping tour.
So along with that, what is you've kind of hit on these. What other things? What are top 3 things that you want to do aside from going shopping, seeing some of your family, and seeing your grandkids. What else do you want to do? What is like for me time for you? What do you want to do? What are 3 things you just want to do?
Besides the family and all of this, a picnic.
A picnic.
A picnic. I want to sit down along the river. We have a beautiful park along the river here, and with a beautiful picnic area where we usually go when it's nice, when it's warm. And now the weather is wonderful. All the trees are in blossom. We have flowers everywhere. The sun is shining. So I would like to pack my picnic bag and go to that picnic area next whenever, because everything is closed, so I could go there. I don't need to wait for a Sunday, right? Go there and sit down and spend the day in the grass just lazing. That's one of the first things I would like to do. And then I want to go up to Bergamo. Bergamo is our city. It's a beautiful city. It's one of these historical places that you must see once, okay? And we have the habit to go up and stroll along the streets. Just look at it because it's so beautiful. I want to do that. I want to do that. And then I want to go out and have a pizza with my friends.
Pizza sounds so good. So this whole thing, because it seems like Canada is just starting. We're just getting into it, and it feels like Italy. I'm hoping that Italy is on the other side of that curve. What's one thing, one lesson you're taking from all of this?
Nothing is for granted. And sometimes I have the feeling that nature is giving us a big warning. We have been talking about it for years now, my friends and me. And it's almost like as if the nature was telling us, come on, that's enough. Start living in a different way. Give the right value to the right things and forget about everything else.
Wow. So, I asked you this before, and again, we'll end off on this question. Unless there's anybody that's watching that wants to ask some questions, you can totally write them down and I'll read them out. But in the meantime, if we go back to some indigenous nations right now, so those reservations that have 0 infections, it's like you're talking to the past. If you could go give a message to yourself and everybody in your village, your town, before the infection hit, what would you tell them?
Do you know? Well, in the villages, I think that your chiefs already know that, because I have met many native people.
Yeah.
Because of a festival that I take part in. You can ask Angela about that. The chiefs in your reservations, they are much more clever than we are. We are thinking too much of things that make you look or that make you feel smart, cool, right? And they think of the real things that have a value, right? So I would tell them, please go on, keep on doing what you're doing. Keep on doing what you're doing.
Keep up with
the chiefs.
So you want the chiefs to know to keep up with the restrictions.
Yes.
And the people.
Have you? Did you know what happened here in Italy a couple of weeks ago when Italy decided to lock down all Italy, beginning of March, right? Mm-hmm. They said from now on you are not allowed to leave the place where you live. Mm-hmm. The same night, hundreds and hundreds of people from north who originally are from South Italy left North Italy by car, by train, by any means they had, and went back to South Italy. South Italy had no infections then. But now they do. And they haven't reached the peak yet.
So if if I don't live on the res. I live in Calgary. If at our stage right now, are you saying that I should probably just buckle down in Calgary rather than go back to my res, which has 0 infections?
Yes.
So stay where you are.
Yes, you should think. Yes, you should not think of yourself. You should think of the others.
That's powerful.
If you are safe at home, stay home.
And so essentially don't bring the sickness to the res is what you're saying.
Exactly. That's what I'm saying.
Wow, that's powerful, because that's going to be a hard thing for a lot of for some of us anyways to hear, because I think for a lot of us we're thinking about, if shit gets real bad, we're just going to go back home. But what you're saying, the responsible thing I think that you're saying, is just to stay where you are.
Yes, unless you're quite sure that you're not contagious.
And you
then you can go.
But you can't be 100% unless you're tested, right?
Yes.
Wow, that is a tough one. But that you have to make tough choices now, because we're not in the same world we were in yesterday.
No. It's different. It's different. And you have to think about the others, not of yourself. You have to think about what you can do to the others.
This is kind of a heavy one when we're talking about.
This is it.
Yeah, you have a lot of strength. I just want to say you have a lot of strength and a lot of positivity. It's really good to hear that. For us, we call it like medicine. It's really good medicine to hear this, because it gives me a lot of hope. I feel like we are on the cusp of hitting this wave. It's just starting. And as I'm talking to you, potentially that's where we could be within a month, maybe less deaths, hopefully less deaths, less infections. And so seeing you, as strong as you are, with the positive nature you have, it does give me a lot of hope that we can get through this.
Find out things that you can do at home, and try not to be in touch with other people. And if you have the possibility, wear a mask. Wash your hands as often as you can. Even when you go to the supermarket, try to wear gloves, disposable ones that you can throw away, or ones that you can wash carefully when you get home again. When you get home with your things that you have bought, wash everything.
Mm-hmm.
Not only fruits and veggies, but if they are packed in plastic containers, wash the plastic containers, because I've heard that the virus can stay alive for quite a few hours on plastic.
So wash them with like soap and water, bleach.
Yes, that's enough. No bleach, no. But soap and water.
Soap
and water, yeah. Plenty of water. Plenty. Yes, soap. The soap melts the grease and everything that's in it, and then the water washes it away. Or you spray disinfectants on it, as long as you don't contaminate the food, of course.
Yeah.
Have to be careful about that.
All right. So lastly, is there any messages you want to leave us here in Canada? Anything you want to leave us with?
We all of us will make it.
That's awesome.
We will make it. We will survive.
So we are isolated, but we are still connected, and we'll make it.
Oh yes. Together. United. Separated but united.
Whew. All right. So we'll check in again with you in like maybe 4 or 5 days.
Yeah.
And hopefully this.
I have good news for you.
I'm hoping. Both my fingers are crossed, and we always when we pray for Italy, we pray for the workers, we pray for the people here. And,
Thank you very much.
I'm hoping you guys get through this, and I'll talk to you again soon.
Do take care.
All right. Ciao.